Yes, I am on the floor, and that is because I will be shortly demonstrating a technique for you called diaphragmatic breathing, and this is just the angle that works best. So, diaphragmatic breathing is a very helpful tool that I teach most of my patients on day 1 of pelvic floor physical therapy, and that can be utilized and employed in many different ways in treatment. The concept of diaphragmatic breathing is inhaling slowly through the nose for 5 seconds and then exhaling slowly through the mouth for 5 seconds. So what that looks like is as follows. Okay, I'm going to place hand over my abdomen and demonstrate inhaling. Exhale. Again, inhale. Exhale. How is diaphragmatic breathing connected to the pelvic floor, and why is it important? When one properly performs diaphragmatic breathing, the diaphragm, muscle that sits right here, moves down. All of the pelvic contents move down, including the pelvic floor muscles, and that is coupled with the descent of the pelvic floor. As opposed to exhalation, when one is breathing out through the mouth, diaphragm rises, pelvic contents rise, pelvic floor muscles rise and return to their starting position. So gross exaggeration, inhales, descent of the pelvic floor, exhale is rise, inhales, descent, exhale is rise. This is important because proper performance of diaphragmatic breathing provides a gentle, subtle stretch to the pelvic floor muscles, especially pelvic floor muscles that are tight or in a constant state of being on. Those muscles want to move. In our body, mobility equals health. No muscle should just be sitting like that, tight. So it's one way that we can indirectly stretch the pelvic floor muscles. Descent, rise, rise. The second benefit of diaphragmatic breathing is that it shifts one's whole mode of functioning from sympathetic fight or flight response to parasympathetic rest and digest response, which means that all muscles in the body, including the pelvic floor muscles, can relax and release. So that's often a tool that I teach my clients, and it's something that they can utilize throughout the day. If they're at work and they feel stressed, or they're running late and they're feeling stressed and they're feeling that their pelvic floor muscles are tightening in response to the stress, they can take a moment, perform a minute worth of diaphragmatic breathing, 6 diaphragmatic breaths, and just help to let the muscles descend, rise, and that parasympathetic relaxation allow the pelvic floor muscles to relax and release. Because people usually can't just take out their dilators at work and stretch their pelvic floor muscles, but they can always perform diaphragmatic breathing.